Imagine waking up each and every morning knowing that the very environment in which you work, in order to allow your family to survive, could be the very thing that kills you. For many South African miners, this is their fate each and every day when they set foot into these tunnels, exposing themselves to silica dust, increasing their likelihood of developing tuberculosis, one of the leading causes of death in South Africa. No protective equipment, no masks, no anything. An occupational crisis out of control, leaving many people wondering, how many have to die before the government decides to step in and take things seriously? Are they currently doing enough to keep people safe? I'm your host, Shanika Kaltenbrun, and this is the Public Health Podcast, a podcast where we ask the tough questions, so you don't have to. Let's dig in. On this podcast, we believe that health isn't just a goal, it's a right for everybody. Healthcare can mean a variety of things to individuals, including the many ways in which one decides to care about their health. This can be from the food that they eat, to the products they purchase, even downright to the places where they live and work. But what if your right to work in a healthy place is compromised? On today's episode, we're diving into the complex web of factors that are driving the alarming prevalence of tuberculosis in South Africa. See, tuberculosis isn't just a disease. It typically is a manifestation of larger societal issues such as HIV, migration, poverty, and it really brings to light the harsh reality of socioeconomic disparities. Consider this: overcrowded living spaces, inadequate ventilation, and occupational risks create the perfect storm for tuberculosis to thrive within our communities. Whether you're an agricultural worker in South Africa or a miner in South Africa, while both jobs are essential, both become a high-risk occupation due to the various social and economic factors. I want to show you a video on silica dust and how it can affect the lungs, and then I want to talk about how this correlates to tuberculosis, and then I'm going to relate that to how this can affect the South African miners and why it's important that we monitor these things.
Silica. It's one of the most common substances on Earth. It can be found in materials like sand and rock, and building products like concrete and brick. When a worker cuts, grinds, or drills materials that contain silica, dangerous crystalline silica dust is released into the air. As the worker breathes, silica crystals flow into his mouth and nose and down the air passages deep into the lungs. The tiny crystals enter the small, fragile air sacs, where oxygen is absorbed into the blood. Immune system cells, called macrophages, engulf and try to dissolve the crystals, but they are unable to. Over time, more and more crystals build up inside the macrophage cells. The macrophages carry the silica into the walls of the lung, where they die. Scar tissue forms around the dead cells and spreads as more cells die. This damage can continue even after the exposure to silica stops. Eventually, so much scar tissue forms that the lungs can no longer function. For information on how to protect yourself.
So that video is really interesting, and it brings to light a couple different things. But specifically, exposure to silica dust can cause multiple diseases including silica dust-associated tuberculosis. And I found an article on PubMed, and it talks about in particular that it still remains one of the highest occupational health priorities in low-income countries, and it still occurs in some high-income countries, but it's pretty rare to have. But silica-related TB is exacerbated by HIV, or human immunodeficiency virus. So somebody with HIV already has a lower immune system. So their body already does not have the ability to fight off a lot of the diseases and dangers of tuberculosis. And so when somebody has this in a low-income country, and they might not be able to have medical treatment or be on medications to assist them with HIV, now this tuberculosis that they have, which can remain either active or dormant in somebody's body, can be spread through coughing, and can really be exacerbated by your working conditions. So what does this mean for the miners in South Africa? Well, we know that they work in places that are in close quarters with one another. So, right, they're digging in those deep tunnels. There's not a lot of space, not a lot of air ventilation. There's no fans or open holes for swift, nice airflow to go through there. And so people with TB, they're coughing in close quarters. They don't have face masks. Now they're digging consistently and exposing themselves to the silica dust, which can be found in rock and debris and stone, naturally within the earth. And they're breathing this in, and they're constantly making themselves sicker and sicker, to the point where they can actually, without treatment and without monitoring, die from this. And so they're going to work to try and to provide for themselves and their families so that they can, be better off and eat and live a healthy lifestyle to the best of their ability. But by doing so and working these types of jobs, which might be the only ones in their area that they're able to do, they're essentially making themselves sick. And what we know about South Africa, or if you don't know this about South Africa, is their gold mines and their mines in general were at one point one of the highest money-making things for their country. It brought in a lot of wealth and a lot of money, and they're not just going to simply stop the production of these materials and mining of the materials simply because there's a large amount of people dying from this. And so my next question is, what exactly have they done, or what are we doing, or what is Africa doing as a nation or as a global nations? When you hear about this, what is, like, the United Nations and everybody else and the CDC and all these big organizations, what are they doing to offer help to individuals who have to work these jobs but who are at high risk? So I wanted to know, from a government standpoint, what exactly they were doing to reduce silica dust-related diseases. And when you look at the history of legislation around the world, for the past 22 years, the legislation in South Africa alone had remained unchanged. In fact, in 2008, the Department of Labor reduced the occupational exposure limit for silica dust in Africa from 0.4 to 0.1, but the limit that they reduced it to is still significantly higher than other countries, including the US, Finland, Ireland, Italy, Portugal, Australia, Canada, the Netherlands, Poland, and the UK. And scientists on these committees that worked with the occupational exposure limits recommended for it to be reduced even further to 0.05, pushing for change and noting that it still was not safe. And so silica dust has been a growing concern and a chronic issue still. And up until the last few decades, there have been steps that have been now set in place to reduce the exposure limits. So in 2008, the reduction of the exposure limit going down by 0.3, but the Occupational Health and Safety Act, so OSHA, came into place also in 1993, which they helped regulate the health and safety of South Africa. They have attempted to amend multiple times regulations related to silica dust and exposure limits. So, although there's been a reduction by the Department of Labor, OSHA has been consistently trying to work with South Africa on educating them on the importance of further reducing their dust exposure limits and what kind of health implications those can have. The Natural Environment Management, so the Air Quality Act of 2004 set standards for air quality emissions, and so they look into specific areas in South Africa, specifically communities that are close to mining areas. They monitor and test air quality to make sure that the amount of silica dust in the air isn't at dangerously high levels. Although it may not be less than 0.1, like they hope for, as long as they're within their legal threshold, where it has to be, around 0.1. It sounds like they're comfortable with that, but as long as it's not going over, the 0.4, they're pretty satisfied with the consistency of it being maintained around that level. The Mine Health and Safety Council also was an up-and-coming project, and their role was responsible for implementing measures to reduce the risk of dust-related diseases in the mining sector. So they have tried to provide unions and representation to advocate for proper protective equipment, regulate how long someone can be in the mines for, how often they're being exposed to mines, what kind of access to medical testing their employees may have, and education on the risks of working in these types of mines. Other things that they've been working on is, compensation for occupational injuries and diseases. So individuals who have gotten sick on the job or injured on the job, they're getting compensation for tuberculosis associated with silica dust exposure, so that if an individual is unable to work or work as much, or they have medical expenses, that will be covered, and them and their families no longer have to subject themselves to such harsh conditions. They can get the proper treatment needed so that they're not further damaging their bodies. And then also the government itself in South Africa has been inviting people within the area and other professionals to take comments and suggestions to draft a national dust control regulation, which would strengthen the regulations for controlling dust emissions and protecting the public from harmful effects of silica dust. They're also in the process of repealing regulations related to the inspection of premises in a dust control area to be replaced by a more efficient system to control the dust. So if they have a way of ventilating and evening out the amount of dust that heavily occupies one area, how they can disperse it in a way where it's safe for everybody, how they can notify individuals who live in these areas, some sort of alert system to remain indoors or wear a mask. They're working on their communication methods. So OSHA recommends to the South African government and just all countries in general, going back to the exposure limit rate, they recommend that individuals have no more than 8 hours of contact with silica dust exposure, and they are also asking that employees have repeated monitoring over the course of 6 months, or where they have the most recent exposure, where an employee indicates where they were exposed above the limit level, that they get further testing and further monitoring in frequent increments. So if somebody has a high exposure of silica dust beyond what was well off recommended, OSHA is recommending that person seek treatment immediately, and that their job is held accountable with ensuring that they set those individuals up with the proper medical resources that they need, and that they continue to have long-term monitoring over the course of 6 months to ensure that their condition is getting better with treatment versus getting worse and causing other long-term side effects. Individuals also in Africa currently are allowed through voluntary free clinics to go get tested at any time. They have a couple unique opportunities to do this, and I'm going to show you a video a little bit more about that.
The South African community at large.
People are still struggling to accept if they are HIV positive, and they will always hide HIV positive status behind TB. There's always going to be that resistance to access services that are provided or that are made available to them. So I think resistance and stigma is one of the biggest challenges that we are currently facing.
As you guys have seen, I've worn this mask that says zero stigma. I feel there's still so much stigma in the community. There's lots of misconceptions how TB means that you may be from an uneducated background, or you're poor, or you're dirty. And there's all these negative connotations about TB, but I think I'm just living proof here that TB can happen to anyone. It doesn't discriminate by race, by gender, age. It doesn't matter. If you breathe the air that we all breathe, then you are at risk for tuberculosis.
The 3HP addresses some of the barriers to scaling up the Eisenhower's preventive therapy, and its benefits are that it's shorter. It's 3 months instead of 6 months. It's only the 12 doses versus 180 doses. It is better in terms of its safety profile. More people complete the treatment, and it has similar efficacy to the Eisenhower's preventive therapy.
We are going to give you the most important and effective medication that is going to help you to prevent TB. Once in a year, for a period of 3 months, you'll be getting that medication, protected, prevented from TB.
The Minister of Health and the President of South Africa at the United Nations high-level meeting on TB in September is likely to focus on 3 priority areas: finding the missing cases, dealing with multi-drug resistant TB, and preventing TB through the scale-up of preventive therapy, but with a focus on 3HP.
I'm definitely confident and positive to say the 3HP medication is going to work beautifully for our patients.
The movement that UNITAID is doing is phenomenal right now in South Africa, and they fortunately have a good amount of funding, and they really work with the community to change the perspective of the individuals in the community that are affected by HIV and tuberculosis. Like the lady in the video said, I love how she said we all breathe the same air, and that no matter who you are, this problem concerns everybody. And rather than raising not just awareness to, yes, the minors and the most prevalent types of individuals within the population, they're getting everybody in on this. Women, children, preventing the frequency of tuberculosis, and telling people when they have HIV. Knowing if you have HIV isn't just going to help you in terms of if you have tuberculosis, it's going to help you with a wide variety of illnesses. Knowing that you are immunocompromised and have a higher risk of getting sick with different types of infections, whether it's influenza or COVID, you can do more and arm yourself with information to further protect yourself, so that if people around you are sick, you can figure out a way to keep yourself healthy. Currently, they talked about how their treatments for HIV are more centralized and focused on the individuals that they're giving this care to. So before, they mentioned that I believe treatment was 180 days for preventative treatment. That's a long time, and that alone takes dedication and time that honestly these people in this type of economic standpoint might not have. 180 days of trying to find a way to work and provide for yourself and go get medical care, which they might be left choosing between going to work and getting medical care. And a lot of times people want to provide for their families, and they're going to choose going to work any day over their own health care. And so they have found a way to shorten the preventative medication timeline. And so they talked about this new treatment for HIV and tuberculosis and a new type of medication. They also talked about, treating children, because it's not just adults that TB is affecting. In South Africa, the children are working too. They're working in the mines, they're working in the fields, they're digging, getting their hands dirty in the soil, and they're exposing themselves as well. And so they have found that they are able to cut the treatment time in half, minimize the amount of doses, so that's more efficient for people. And as a result, they've noticed so far that more people are likely to complete the preventative treatment programs. And so with the availability of this more efficient preventative medication, the hope is that they're minimizing the amount of tuberculosis altogether that they're seeing, especially clusters of tuberculosis within a specific community. If they can minimize that risk and they can isolate cases and further isolate where this prevalence is coming from, they can deal with a more innate problem. If the problem really is environmental in specific aspects of where people work and it's occupational, then they can work on occupational hazards and coming up with solutions systematically. And it kind of will become full circle. But before, if somebody had TB, you would have to go through 12 weeks worth of weekly medication. They're talking about 3-HP, which is a type of medication. It's self-administered therapy, or you can get it done directly at a health center. The CDC recommends the treatment regimen for a person with TB infection and HIV who are also on antiviral medications. There's also medication that is 4 months of taking rifamycin. That's another treatment option, but it can't be used with people who are taking antiviral medications. So there's two different types of treatment options, which is great because there are some people with HIV who have it, who have to take an antiviral medication, but they could also have tuberculosis. So they need medication to take. And 4 months was better than the longer, more previous dose that was I think 2 times that, which is 8 or 10 months worth of medication. So the fact that they are working alongside pharmaceutical companies and other industries to come up with medications that encompass a large variety of people is even better. So I want to talk about some risk communication strategies that I feel would be beneficial to individuals. And if I worked for the government in South Africa, what types of things I feel like I could be doing to help my community further spread awareness. And I have a list here that I've written on my computer, and I'll share some of the stuff with you. So I think it's going to be important because you're educating a broad variety of individuals to have clear and accessible information. So obviously you're not going to have access to technology like we would maybe here in the States. And so one way you could have clear and accessible information is you could hand out pamphlets. You could have large, colorful posters and pictures advertised throughout the different communities in South Africa. The information could be handed out at high-risk occupations. So if you work as a miner, your job could also have like OSHA signs and signs on the wall, things that maybe look like this that show like danger. You're going into an area where you have a high exposure, so that people are aware of what they're doing and that they're even at risk. Because some people might take a job not even physically knowing the risk of the job or thinking of risks at the time of taking a job. the use of like multiple channels, making sure that you are communicating things through schools. So children, unfortunately, once they start to kind of reach a certain working age in Africa, not all families can afford to provide for their children as they get older, so their children unfortunately have to work. And so as kids start to become of age to work, I feel that schools can start to tell kids about occupational safety and just health risks in general and how to protect yourself and live healthy lifestyles. So by going to the doctor and getting your annual checks and encouraging your family to seek medical treatment when they're able to. If there's community centers, putting up posters in community centers, and of course, as you have organizations like Doctors Without Borders, if the CDC sends people in to check up on high-risk areas, making sure that those organizations are also on the same page with continuing to inform people within the community of the risks to them, so that they're aware. Making sure that you're having an engaged community, that their community officials, leaders, influencers are spreading awareness as well, where they have community meetings. Maybe they can have in-person community meetings once a month, where people, or a couple times a month, where they can go and listen about important topics where they live, and it can be brought up as a concern and just something on the agenda to, again, reiterate the importance of getting tested. Addressing the stigma and discrimination, I think that Unit 8 is doing a great job with this, with the masks that they're wearing, saying end the stigma, we all breathe the same air, everybody's at the same risk. And you know, if somebody says, hey, yeah, I have HIV and I think I have tuberculosis and I want to get tested, praising that person for taking the initiative and to better themselves as well as their community, and applauding them for being brave and going out there and getting the help that they need. Because there's nothing wrong with asking for help. And there's this social stigma of being dirty or in poverty. Anybody can have this happen to them. It does not discriminate. Disease does not discriminate. And so really making sure that people understand that, and that we show support of that, and have this whole not acceptance for bullying or toxic mindsets when it comes to people who are affected by these diseases. I think that's going to be great. I think making sure that we continue to have some free resources and promote from a United Nations standpoint and a leadership standpoint, when we go to other countries or organizations approach us, that we continue to advocate for funding so that you can maintain your free clinics. You can promote testing and counseling in areas with people that might not be able to naturally afford it otherwise. Because that's going to be a key factor as well, these free clinics and free resources, where people can come regardless of their financial background, and they can set aside their financial burdens to get the help that they need. Because just because somebody's poor doesn't mean that they don't care about their health. They just might not be able to afford to manage their health, which is a sad thing in the world. Everybody should have the right to healthcare, no matter who you are, where you live, what you can and can't afford, what you've done in the past, what your goals are for the future. You should have access to quality healthcare, and you should have a right to care for yourself in a healthy way and live a healthy lifestyle. And then having continual feedback and evaluation, getting the community's perspective, question people in the community, ask them, what are your needs? How can we help you further understand your health in general in the area that you live? How can we support you? I think is going to be huge. So getting out there in the community, being hands-on with people, and asking them, getting involved, that's going to be huge. And so I think having some sort of collaboration and partnership with individuals and people within the community so that it comes full circle is going to be huge. So I think by employing these strategies, it's possible to improve awareness, reduce stigma, encourage early detection, and promote adherence to treatment regimens for TB and HIV. And I think this can also just be applied to other diseases that are prevalent within a specific area. But I think that by doing these things versus not doing them, you're going to see a decrease in the prevalence and an increase in prevention measures and the rate of prevalence and how it's, burdening individuals. My name's Shanika Kaltenbrun. This is a public health podcast where your health matters. We ask the tough questions and we get the answers. See you guys next time.